My name is Dr. Ellie Faricy, and I'm a pediatric pulmonologist at the University of Vermont Children's Hospital, which means that I see children and teenagers and babies who have lung and breathing problems in the hospital and in the outpatient clinic. And I'm also a Burlington resident and a parent of children in the Burlington school system. Electronic nicotine delivery system, or ENDS, are also called e-cigarettes, or some people call it vaping. And these are products that usually contain an aerosol that is inhaled that contains usually nicotine, some degree of flavoring, which is a chemical flavoring, and then something to carry that in, which is usually propylene glycol or vegetable glycerin. The size of the particles that's in the aerosolized vapor is really, really small, and that allows it to bypass a lot of the defense mechanisms in the lung that are designed to keep things out of the airways that are not meant to be there. These products tend to be really irritating to the airways, and so people who use e-cigarettes and ENDS products on a regular basis are more likely to have symptoms of chronic bronchitis. So what that means is that you've got a cough that lingers after colds a long time, or you're making phlegm when you're not sick, or you're having shortness of breath with activity that you didn't have before. We do know that a lot of the same types of symptoms are seen in people who vape other products, who vape cannabis. So that ongoing cough or shortness of breath, or if having a long time to get over colds, we would see that as well in people who are vaping cannabis. The lungs did not evolve to hold up against constant inhalation of things that are not air. So as the heat not burn industry and as the vaping industry kind of takes off and people start imagining what other substances you can vape, it's really unlikely that there's going to be anything that's really safe. But the bottom line is that inhaling any kind of oil into the lungs is a really, really inflammatory thing to do, and it's going to be irritating even if it doesn't contain all the other additives. Most of these ENDS products contain nicotine in a kind of a salt form, which makes it a much more potent type of nicotine to get to the brain. So it's able to get in a less irritating way to the body because of the flavors, and then the concentration of the nicotine in these products is a lot higher than what's in combustible cigarettes. And the nicotine is really affects the brain in a potent way, particularly for adolescents. So adolescents are undergoing a big rewiring of their brain where different pathways are getting emphasized more. And if nicotine hacks into these kind of pleasure pathways, it makes it harder for youth who become dependent on nicotine to break that addiction. And that's why we know that adults who are dependent on nicotine, often 90% of them started before the age of 18 using some sort of nicotine-containing product. So we know that the young adult and youth developing brain is uniquely susceptible to the effects of nicotine. Once somebody is nicotine dependent, it's really hard to just quit that by yourself. It's a dependence. So the brain has been changed by exposure to nicotine. And so the youth that I have seen who've successfully been able to break their addiction to nicotine-containing products have had really good support from their parents. They've had support from counselors or community organizations. And in some really severe cases, they've needed support from their pediatrician in the form of nicotine patches or nicotine replacement to help break that dependence. You should see your pediatrician as a resource, and if you need more support, that is a really good place to start. My Life, My Quit website is also really helpful. It's free, and there's access to one-on-one coaching for how to quit your vaping use, and it's helpful in making a quit plan, which is really important for people to realize that it's hard. It's hard to break a dependence to nicotine, and it's not super comfortable sometimes. And the people who know what to expect when they're going through nicotine withdrawal or changing these patterns are more likely to be successful because they've got a plan at how to deal with those curveballs when they come. I want parents and kids to know that the promotion of vaping and the e-cigarette industry is just the tobacco industry reimagined for this generation. And I really want youth to be looking at what kind of ads and representation of this substance use that they're seeing online and use a really critical lens to look at that, to say, what are they trying to sell me? Because it's really in the industry's interest to trick kids into trying it once or twice or 3 times, and then to create kind of a lifelong dependent user.